Welcome back. I'm Bill Nazaroff, and it's my pleasure to chair this final session on interventions and risk communication. And I think in the interest of time, I will do no more but introduce our first speaker, George Gray, who's a professor of environmental and occupational health at George Washington University. So welcome, George.
Thank you very much, and it's a pleasure to be here. And it's a little daunting, though, because this is going to be, here at the end, we're sort of doing a big change of direction and talking about perhaps some things that feel a little different to those of us who are analysts and biological scientists and physical scientists. But as the discussion yesterday certainly pointed toward, a big part of the question around indoor PM is, what do we tell people and how do we tell them about this? And it's especially important because, as we know, in the world in which we're working, persuasion is really the only thing that we can do. There are not regulatory reaches into the indoor environment. And what we've got to do is help people understand and make decisions. Another thing I'll tell you is that this is a place where we don't have much data to look at. We don't even have, we don't have almost anything that we can point to. So the three of us who were asked to talk about this sort of just divided the world up into thinking about an introduction. Where are we? How do people think about this? What are things that we have to be aware of when we're trying to talk to people about the potential risks of indoor particles? To look at maybe some places, like a lot of you are doing, that we can borrow from circumstances that might be similar enough that we can begin to learn some lessons. And then third, to think about what's the work that needs to be done? What are the things that we want to do, that we need to understand better, in order to think about going all the way from the chemical and physical sciences and the epidemiology and biological sciences into something that we can communicate to the general public. So what I want to do is talk a little bit about what we know about how people feel about risks. That's the part that makes a lot of us as scientists a little uncomfortable. It's not just about how big they are or what we know about them or how we can control them. People feel about risks, and it's pretty important in the way that they receive information that we give them. I want to talk about why some of these things are going to make it hard for us to communicate about indoor PM. And then finally, just kind of foreshadow some of these areas that are out there where we might be able to learn about other places where people have tried to do something like this to greater or lesser levels of success. Let's see. Excellent. So the world of communicating risks is something, there are entire professions that have done this. The academies have done many reports on how we think about communicating risks, whether it's in a medical setting, an environmental setting, or some other setting. And the sorts of quantitative things that, in fact, we closed with right at the end of the last session. How big a problem is this risk? Are really important. We need to understand those things. We need to have the science done to have the science done right. We need to understand how big these risks are, what we can do to intervene and reduce those risks. And we need to know risks to whom. We heard about the potential for pregnant women and their children. We heard about the risk to elderly people. There could be occupational risks. We need to know the quantitative facts. But another thing that we really have to think about is how people feel about risks. And here I'm going to be pulling from a literature that's developed over the last 20 or 30 years, led by people like Paul Slovic and Baruch Fischoff, and many others who've really come at this mostly from the world of cognitive psychology. And they've looked at risk differently than most of us do. So they've identified factors, things about risks. These are risk personality factors, perhaps, or they're characteristics of a particular risk that influence whether people are likely to be more or less concerned about it. And for example, here we can go down these things. Things that cause fatal injuries. The thing on the left tend to be things that make people more concerned about a risk, if it has that property to it, less concerned if it's these things that are here on the right. So for example, things that cause fatal injuries, people tend to be much more concerned about than non-fatal, although a lot of the things that we're talking about, like reproductive and cognitive effects, are the sorts of things where people can become very concerned too. You can see a lot of these things that are important. A very important one is whether something is voluntary or involuntary. And that sort of means, am I choosing to do it or is it being thrust upon me? And things that I'm choosing to do tend to be things that, even if I know they're risky, I go skiing, I go scuba diving, I know those things are dangerous, but I'm choosing to do it. I feel very differently about that risk, and I want different things done about that risk than I do when someone's imposing a risk on me that I have no control over. Um, Things that are seen as potentially catastrophic are of greater concern, things that influence future generations, things that might be increasing rather than decreasing. So these are some attributes, but there's even more. People tend to be less concerned about things that are observable, more concerned about things that are not observable. And this you can think about things like radiation, chemical exposure, particulate matter, except for those pictures from China. Most of the time, particulate matter really isn't observable. It's something that we know is around, we can measure it, but people don't have an intuitive feel that it's something that they're immersed in. And that goes to this question of whether people know about their being exposed or things are immediate, whether something is old risk or a new risk, and how well people believe science knows about it. Things that people say, it's been around a long time and science has a pretty good handle on it, tend to be things they worry about less. New things are the sorts of things, Zika virus, where people all of a sudden become much more concerned, perhaps concerned even out of proportion. There are a few more things that are important, questions of where this comes from. People look at man-made risks with much greater concern than natural risks, just generally across the board. Things that affect children are important. Where the either the risk is being generated or the people who are telling us about it, can we trust them or not? Things that get media focus is really important. Think again, Zika virus versus indoor air pollution. When's the last time you saw any kind of a news story about indoor air pollution? It's just not one of those things that gets a lot of attention. Things with identifiable victims. And then finally, a really important thing is, do I get a benefit out of this? Most people intuitively know that their mobile phone, and certainly using it in their automobile, is really, really risky. And they do it anyway. Because they imagine or they feel that there is an immediate benefit to them saying, what do I need to get at the store on my way home? Where are you? What's going on? The benefit, when there's a tangible benefit, people tend to want to believe, and therefore to believe, that the risks are smaller. If they don't see a benefit, it's an additive in my food that I didn't ask to be there, and as far as I know, it doesn't have to be there, they're much, much more concerned. So this benefit issue comes in very strongly as well. So why is indoor PM going to be hard? I put this together before I listened to everything yesterday, and I identified there's even more things that are going to make trying to communicate to people about indoor particulate matter and the potential hazards that it may bring really hard. Part of it is it's a familiar risk. It's in my home. My home is my castle, or it's my place that I go. It's safe. Cooking is, we make comfort foods when we cook. We do things that make us feel good. And now you're telling me that doing that is a source of this risk. Things like candles. I don't know if you can see this picture. This is my Valentine's Day is coming. Here's a little candles and wine. People choose these things. You walk through the mall and you see the Yankee, well, no, you don't see it, you smell it first. The Yankee candle shop. There are lots and lots of benefits that get out of people using incense every single day. It's part of a cultural or a religious thing that is really important to them. And when we start reminding people, oh, I know what the one was yesterday I hadn't thought of that's here, pets. Oh my gosh, my pet is a problem. That's going to be a really hard kind of thing to get through to people, that they're going to want to be willing to take actions to somehow reduce their exposures. And if reducing their exposures means doing things that can influence all of these things that mean a lot to them, it's going to be a problem. These are voluntary risks. People are choosing to do them. They're in their own homes, and most of the time, except for the infiltration from outside. So here I'm thinking a lot of the indoor sources. And people just there are many benefits to these things that people, that we know are sources that we have to be concerned about. Now, there are perception factors that may actually benefit us if we want to think about how we're communicating to people about indoor air. Children could be at risk, as we've just heard, maybe even developing fetuses and babies. These are controllable. And I learned a lot yesterday about the things that are out there that would allow us to reduce exposures, whether it's from outdoor sources or indoor sources. These things are controllable. I did hear a lot of discussion about the cost of that control, which is an important part of how people think about risks. Some of the sources are already things that people think about and sort of know are bad. Things like environmental tobacco smoke is a place where people said, that stuff is a problem, and people have changed their behavior around environmental tobacco smoke. There's a fair amount of knowledge, I think, in the world about the about the risks of particulate matter outdoors. But I think most people think when they close the door, that stayed outside. And the public does seem to have a little awareness. And this is a place where I could actually find one study that might give us a little bit of information about public perceptions of the risks of indoor air. And this is from a study from Canada. This was done, Paul Slovic, working with Dan Krusky at the University of Ottawa, did some public perception surveys asking people just in a long list of risks. I don't know if you can read these, but it ranges from cigarette smoking and motor vehicles to ozone depletion and alcohol to mold to power lines to prescription drugs and genetically modified organisms, and asked them to say whether they thought this was, to them, was this a high risk, moderate, slight, almost no risk, or they don't know. And the only thing that you can pull out here, so this is asking the Canadian public. And the Canadian public put, wow, my arrow didn't come in very well. Indoor air pollution is right here. And if you add up those who said this is a problem, as opposed to those who said it wasn't, about 80% of the Canadian public said indoor air quality is something that I should at least be thinking about. It is some sort of a risk to me. The interesting thing was this study also asked a group of toxicologists the same thing. So they asked sort of scientists who might be in the know, is this a big risk? So this is getting at, with many, many risks, we worry a lot about the fact that there is what's sometimes called a perception gap, where the view of the experts who study this doesn't match the view of the public. This is one where it actually seems to, which is another thing that could be working in our favor. About 80% of the experts who were surveyed also said that indoor air quality was a slight, moderate, or high risk. They put it in the bin of things that were potentially a risk. So this is really one of the only things that we can find out there that helps us understand how the public thinks about indoor air quality, whether it's something they're aware of and have some concern about, and whether we have that problem of a perception gap. In both cases, it looks like the answer is yes. The public knows about it, and in general, this actually, there were very few Canadians who said they don't know about indoor air quality. There were some risks where they said, I don't know if genetically modified organisms are a problem or not. This is one where people had a pretty strong belief that they knew something about it and were willing to say whether they thought it was a risk or not. So this is something that gives us some hope that maybe something can happen. Within this, though, there are a variety of other challenges that we have to think about. And again, back to that, the question that we brought up just right at the end of the last session is, somehow we have to know how big this risk is before we decide first how much we communicate about it. Is this one that there's a limited amount of bandwidth that people have for thinking about risks, and everybody thinks they're doing something that people need to know about. Maybe we even need to put it in the elementary school curriculum. I mean, this is something everybody needs to know. We've got to make sure that when we're taking these actions, we're doing it about things that matter. So we have to have a good understanding of the magnitude of that risk and think about how we communicate it. And that can be comparatively. I heard I think it was Brent yesterday said, you can compare, maybe this is something where we compare the risk to environmental tobacco smoke. And that's something that will get people's attention. But he also said, but if we compare it also to the risks of cooking with a gas stove, that's exactly downplaying how people think about these risks. So we've got to think about both how big they are and how we're going to help people understand that. The relative contribution of sources is important, and how much of this is under my control. One of the things that people want to know, if you're going to talk to them about risk and communicate with them about risk, is what can I do? Don't just tell me to be scared. Tell me that there's something I can do. And understanding that is going to have some influence on understanding indoor versus outdoor, the mitigation options that we talked about yesterday. What are things that we can do? The things that are going to require changes in personal behavior are really, really hard. And I think one of the things that Bill talked to us about is when you look at places where we've tried to intervene on similar sorts of things around changing personal behavior, it's really hard to do. Either because people feel the benefits, they don't feel the risk is big enough, they just don't want to do it. There are some success stories, and that's a good thing. And then the other thing to think about is some of these risk trade-offs that are out there. And those came up several times yesterday. They included things like ventilation and energy use, things where people may change their activity because of the message that we give them about avoiding the indoor PM problems. So there's a variety of places where we have to make sure that when we're giving people things to do, when we're telling them about risk, we're not inducing them to do things that we're concerned could actually increase risk. So I'm just going to touch on a couple of these, and Bill will go into more detail about them. The question is, what are some other places where people have tried to do something like this, and what can we learn from those? So as I said, we just don't have the same sort of information on indoor PM that we have in some of the other other areas, but we can, like you, try to borrow. So indoor radon is an obvious analog. This is even something that's of concern to the same part of the Environmental Protection Agency. There is some research there, and we can look at that about how people look at the risks of radon, what they are willing to do, how that perception has changed over time. One thing that's different about this is radon doesn't have a benefit to people. Nobody says, except for people who go to radiologic springs to soak, but in general, if there's radon in your home, it's not something that you're happy is there. So that makes it different than some of these indoor sources of particulate matter that we're talking about. Secondhand smoke is a big one where we have seen real changes in behavior over the last 20 years or so. It's got some similarities. It's got things where we talk about kids being at risk. That's one of the things that I think got a lot of people's attention, that it's voluntary. It's associated with a particularly dread or bad kind of an outcome. But it does have different levels of just awareness. People's knowledge and concern are different, and the outcomes are different than some of the ones that we're talking about. This came up, and this might have been Bill. We had a great phone call trying to think about what are some things that are out there that we could work on. And indoor pesticide use was something that we thought of, which is something where part of what you're trying to do is communicate with people how to minimize risks. But people they're using something that they're dealing with something that they know is potentially dangerous. It's got a benefit to them. They're using it because they're concerned about some sort of an infestation. It's similar to what we're thinking about because it does have a voluntary nature. It has benefits to people. Kids are potentially at greatest exposure with that. It is different in that people with think about pesticides as man-made bad things. And that's different than they think about the incense that they burn in their home or their use of a gas stove. And then a final thing that a couple of people have referred to is indoor air quality in the developing world, places where we know because of the use of biomass fuels, there is a good deal of evidence coming about the harms from that particular exposure. A lot of it is from similar kinds of things like cooking, but it's really different in terms of both the levels of exposure, the kinds of the fuels and the kinds of things that make particles, and also then the mitigation options that are available to us. So just to close, if we're going to do this well, we need good information from the sciences that are represented here, thinking about the size of the risks, but we also need to understand how the public thinks about these risks. This is something where there is opportunity for more research to understand kind of the state of play today and how it might change in the way that the public thinks and feels about this work. And maybe we can borrow information from other sorts of similar situations to help guide us to think about how we can be effective in communicating this information if and when we decide it's the thing to do. Thanks a lot.